Hi, and welcome to our podcast on coronavirus education. We are going to be focusing heavily on coronavirus education and how not to die. I know that's a provocative title, but it's very clear that people who are healthy die at much lower rates, over 10 times lower rates compared to people who are immune compromised or sick. And we're going to help you understand where you are on what I call that health disease continuum and what you can do to reverse that and improve your odds against dying or having severe symptoms from coronavirus. So today I just want to cover some basic topics on how to lower your risk of dying or having severe symptoms from COVID-19. What's the CDC approach? What are your risks that are known and easily measured? What is Harvard Medical School doing for measurement? What are your risks that are unknown? And this is really important, and I'll dive into that a little bit later, and that'll be a major topic of conversation during our podcast. And what can you do to lower your risks once they have been determined, whether they're unknown or known? And of course, we'll help you determine those unknown risks. So what's the CDC approach? It's really, have you been exposed so you don't spread the disease? And when do you see a doctor? That's pretty much it. But there's nothing really on what I call self-empowerment. And if you take their checker quiz online, you'll see they're really just trying to find out where large pods, where groups of people are getting this disease so they can map this out and develop a strategy. It's not about really helping you as far as I can tell. Obviously, their focus is on population. We're all about you. So what are your risks known in terms of the coronavirus and COVID-19, the disease? So this is from the CDC, people who are at higher risk for severe illness and dying. And it's pretty clear that immune compromised, people with pre-existing conditions, we're going to be focusing on immunocompromised because that's more difficult for you to ascertain where you are. Obviously, if you're on a cancer treatment, they mention that. But a lot of people are like pre-diabetics. You're not diabetic. Are you at high risk? Do you even know if you're pre-diabetic or not? These are the kinds of issues that we're going to be bringing up. So here's the chart, what you can do to improve your odds against coronavirus. And this is a chart based on mortality, dying. So you can see pre-existing cardiovascular disease, 10.5%. No health conditions, 0.9%. That means you can increase your risk of dying by 1,200% just by having cardiovascular disease as opposed to no health conditions. And a vaccine and a treatment may not be your cure because the current flu shot is only 58% effective, whereas this improving your health status is over 90% effective. So what is Harvard Medical School doing for measurement for people with COVID-19? Let's look at this. This is the Harvard Medical School Mass General Hospital guidance for COVID-19 treatment. And what they want to do is risk stratify who is more likely to advance quickly versus who is probably going to leave the hospital. And here are some of the tests they're doing. I won't get into this, but we understand all these tests and actually make them available. Your issue is right now with Harvard is you can only get these tests for risk stratification if you're hospitalized. I don't believe that's right. I think everybody has a right to know what their risk is for severe COVID-19 disease or from dying from the disease. So what are your risks unknown? This is a really important topic that we'll be covering in great detail. This chart, it's a complicated chart, but it comes from the New England Journal of Medicine, the top medical journal in the world. And what it basically says, if you follow this curve here, is that although chronic diseases incubate slowly, they strike quickly. So you may be walking around with a latent or unknown disease, and suddenly you have a heart attack. Suddenly you're diagnosed with diabetes. Suddenly you break out in a rash and have an autoimmune condition. These things don't happen suddenly, and we'll show you how to measure for that and actually reverse that process. So what can you do to lower your risks? First of all, measure. Find out what your risks are. How far up the continuum are you? Okay? So we can risk stratify anyone and provide solutions to reduce your risk. Whereas at Harvard, they are risk stratifying only those who go to the hospital with COVID-19. Here's a chart of one of our lab tests that we do, and it's just a partial chart, but you can see we're doing many of the things that are in the Harvard thing. The Harvard testing, the metabolic panel, the C-reactive protein, the sedimentation rate, the clotting factors, so white blood cell counts, lymphocyte values. So we're looking at these things that Harvard considers important in risk stratification. And here's a before and after for an Indiana manufacturing company, an individual, where we reduced their metabolic risk. We reduced their C-reactive protein. We reduced their white blood cell counts. We reduced their lymphocytes. We reduced these markers that Harvard considers very important to stratify your risk and determine who is more likely to have severe COVID-19 conditions or symptoms or disease compared to those who probably are going to do very well, have mild symptoms, and go home and be well. So Dr. Lewis here, coronavirus education. I'm from MIT. My mentors are all from Harvard Medical School. We've developed algorithms, education, and protocols to help you overcome chronic diseases and, more importantly right now, the coronavirus.